Hello, everyone, and welcome to CCA's Medical Minute podcast, sponsored by Kroger Health. And happy holidays to you. Holidays, winter, just so much going on. So we're here to talk about how to stay healthier during these cold winter months. Joining me today is our nurse practitioner and director of clinical operations, Jill Hunt. Hi, Jill.
Hi, Sherry. How are you?
I'm doing really good. You ready for the holidays?
I'm getting there.
You have little ones, so you really have to,
Lots of preparation.
Lots of preparation, and you're going to be talking about how to keep them healthier as well.
Yes, absolutely.
Okay, and also our director of precision oncology, welcome Andy Guinea-Gundo. Andy, how's it going?
It's going pretty well.
Okay, you've been doing some traveling lately.
Yeah, I just got back from Europe on Friday, and I'm still waking up.
All right, and you managed to stay healthy, so we're going to find out how you did that. Now, it is cold weather season, and I'm going to start because I have these two experts next to me, so I need to, be a little bit, hype it up. I need to step it up a little bit. Dr. Benjamin Bleier from Harvard actually did a study, and it's in the Journal of Allergy and Clinical Immunology, and it talks about the impact that the cold air has on our bodies. We actually get more colds during the winter months and more upper respiratory type illnesses, literally because of temperature. The temperature in our nose, that's at least one of the big factor. If it is decreased by as much as 9 degrees or as little as 9 degrees Fahrenheit or as little as 5 degrees Celsius, it has the ability to change our biological and molecular structure, which means that's going to cause the damage to occur to the immune response in our nose. And that in and of itself can cause us to get more.
Sure, everybody knows this.
Everybody knows this.
I was actually just sitting here thinking, we were just talking about how to get through the holidays healthy.
Yeah.
And she brings out the Journal of Allergy and Immunology.
It's important because these are important things because there is a real science, of course, behind why we tend to get more colds and things like that during the winter months. So we want to be able to, we say protect your nose. I mean, protect your bodies, cover your head, and do all these things. We're indoor a lot, and that means we're going to be passing germs around a lot. And just by knowing that our body temperatures and our nose temperature actually a decrease in it can lead us to more susceptibility from colds. So what do we do, Jill?
Well, I feel like, especially coming off of COVID, I feel like we've started implementing just some practices that maybe we didn't have pre-COVID. I still catch myself every time I go to the grocery store. I use the sanitizing wipes. I wipe off the handles on the carts. I probably use hand sanitizer when I'm out in public more than I did pre-COVID. Very conscious about touching my face, especially when I've been out and about. You just want to keep your hands away from your nose, your mouth.
Exactly.
And just lots and lots of hand washing.
And we're inside a lot, of course, allowing these germs to spread more rapidly from one person to the other. Of course, Andy, yeah, you said everybody knows it, but sometimes we have to be reminded of things to do because it becomes such a second nature that sometimes we can forget the simplest things. For cancer patients out there, their immune systems are taking a big hit just by the fact and virtue of the therapies that they're receiving. What do we tell them? We say some of the same things, but is there any additional things they can do?
Well, I think cancer patients, especially the ones on treatment with, especially traditional chemotherapies and other therapies as well, their immune systems are affected. And so any one of us who have presumably normal immune systems can be affected by the holidays, by the groups getting together and all that stuff. But if your immune system is kind of down for the count, that makes it all the worse. So I think that the knowledge of where's my immune system at? And you can tell this by looking at your blood counts, talking to your providers, saying, how is my immune system? Is it okay for me to go to church, to get these big groups and hang out? Is that okay? But by that same token, it should be okay to say, you know what, Uncle Joe, if you're not feeling so well, maybe not come to dinner.
Yeah.
Those folks need to, yes, do you want to see them all? But if they're not well, then maybe we'll see them in a month from now.
So you're saying the cancer patients definitely need to know where they stand. They need to know how their resistance is looking. So you can always talk to your clinicians and find out, of course, if you have, some large family gathering, things like that to go to, you want to know where your count is and how things stand. Also, a lot of times you have small children, you have little ones, and,
I lovingly refer to them as germ buckets.
Yeah, that's what I'm saying.
From the softest place in my heart, because they have no personal space. And the thing with kids is that they can look and sound healthy 1 minute and they wake up in the middle of the night and have a fever to 103. And most people will tell you that you are the most contagious 24 hours from the time that before the symptoms started.
And I say the little ones because during the holidays, you tend to spend more time with family and friends and everybody, again, as I said, inside more often, spending a lot of personal time together. What can we do in terms of, there are a lot of those over-the-counter things I see people taking, the energy type tablets and all of
like
that.
Like the energy C stuff, that's the vitamin
C's and all of that. Does that actually help?
So I'm not saying that I don't think that those are good ideas to support the immune system. And for everyday people who are not getting cancer treatment, absolutely. Because the honest answer is that you can't really overdose on vitamin C. You're going to excrete it through the urine if you end up with an overabundance. So that's a great support structure. However, for our patients who are on chemotherapy or immunotherapies, there's not a lot of data out there on how these drugs interact with those types of therapies. So they do not recommend that any patients that are actively under treatment for cancer, that they actually use any type of supplement without actually having the discussion with the treating oncologist. The other piece too, and I really want our cancer patients who are out there who are headed into the holidays to remember, the holidays are about the time that you spend with your family. It doesn't mean that you have to do it all in one day. So if your counts are down, if your energy level is down, you have to listen to your body, because at the end of all of it, we want you to safely get through the holidays.
Yeah.
So try to do smaller family gatherings. Instead of getting together with everybody from mom's side of the family, maybe just have smaller, more intimate gatherings so that you can have a little bit more control. And then, yes, it's going to be more get-togethers, but it also can be shorter get-togethers as well.
I like that. Just kind of taking a look at all the different things that you have going and maybe splitting some things up. Andy, what about all of our vaccinations and things of that nature? I know that, first of all, the cold season is going to be, off the chain as it usually is, but now we are adding all the other things like the COVID and the RSV and also the flu. So I know that a lot of folks should be vaccinated if they're going to get it now to kind of, head off the winter, but it's still not too late.
Oh, certainly not too late. Now, in terms of the patients themselves, they really need to talk that over with their team and say, is it the right time to get a vaccine? Should I have gotten this before or whatever? Talk about the timing. Talk about when should I get it in relation to my treatment. Talk about all of that. So just don't show up at your local pharmacy and get vaccinated without having that discussion. But that doesn't mean that the rest of your family can't get vaccinated.
Right.
So
that's true.
I'll tell you a little story. When my middle one was little, allergic to eggs. And so she could not get the flu vaccine initially. So the doctor suggests that we all get it for sure. And so that would protect her because she couldn't get it.
Right. That's right.
So that certainly can carry through to if you guys all get it, but your cancer patient can't get it, that does serve as a little bit of at least a family shield that maybe you're having a less chance of catching the flu and then passing it on to your family member.
Of course, this is all great information for those patients that are going through cancer treatments and for the community at large. You cannot forsake these reminders to wash your hands, as you said, use those hand sanitizers, cover your mouth and nose when you're sneezing and when you're coughing. And also something that I've been doing really is kind of allowing a little air to flow through the house, even though it may be cold. Sometimes when you get a group of people to come in, I usually kind of like maybe just crack the window a little bit, just to allow some air circulation in your home.
As long as you don't decrease the temperature in your nose by 9
degrees or more.
That's critical. So you know what? If you're going outside and it's cold and blustery, put your hat on, wrap your scarf around your. You see these pictures with people with the scarves around their face. It's because you're trying to protect your nose. You're trying to protect your mouth from air coming in and out. Because again, it sounds like it's kind of funny, but something that simple can help you
make a difference.
That's right. It can help you. So just keep those things in mind as you're moving about the tri-state and the greater Cincinnati area this holiday season. We want you to stay healthy, happy, and have a wonderful holiday season. So keep all of those reminders and those things as tips from us to you. We wish you happy holidays. Don't forget to share this, to like it, and to subscribe. Happy holidays.